Petsey from Phoenix, Arizona, talks about her laparoscopic gallbladder removal surgery in Tijuana, Mexico. She expresses her happiness over communication, quality treatment, and facilities at the hospital in Mexico. This is a two-part video series.
I had the procedure on October 20th, so this is December 3rd today, so just about 6 weeks ago. So I'm fully recovered. The procedure itself, certainly it's surgery, so any way you look at it, I had some recovery time, but I would do it again in a heartbeat. I would recommend that anyone else do it again. I would not hesitate. If something else were to come up, and hopefully it won't, but if something else were to come up, I would again go out of the country to have it done. There were actually just a couple of things that were particular. I'm not sure if it was just being in Mexico and being at the hospital there, or if this would be the case everywhere. If I were to go again, my poor husband went with me, and he stayed with me through that whole time. We certainly should have packed some snacks for him, because it was difficult to get those kinds of things. They certainly had plenty of food for me, and it was plentiful, and it was delicious, but it was he really needed to be fed, and I would have certainly done that. I probably, this sounds very strange, but it was real difficult to get linens, towels, and washcloths. They gave you bath towels, but there were several times, especially the first night, where washcloths would have been nice, and I think it's just a cultural thing. I just don't think they had them there. The linens were clean. They changed my bedding every single day. They gave me a clean bath towel every day. But there were, I would have had that. And then the third thing, I most certainly would have gone. I think you owe it to yourself to learn a little bit of the language. There are so many quick and easy courses now, and I wish I had known a little more Spanish than I do. It's something I've been meaning to do for a while, and even a 6-week crash course would have helped. As it was, we had Wi-Fi in the hospital, which is amazing to me, and my husband had his laptop, so we were using a little interpreter on the laptop, and it worked out pretty well. Of course, now I stayed in the hospital. Here in Phoenix, it was outpatient. It was interesting. When I went to my doctor, and I went to the gastroenterologist and talked to him about having the procedure done, he had no idea what it would cost. He couldn't tell me what the cost would be. But after some research, the assumption was that it was going to be about a $35,000 procedure. I have a $40,000 deductible on my health insurance. So I had to look at that. I paid $5,600. So I paid airfare. I think it was $69 each way to and from San Diego, but that was it. And we stayed one night at the Marriott in Tijuana. The doctor asked that I stay one extra night there. There were a few little complications, but I am sure that I saved $25,000 easily over what it would have cost me to have it done here.
Medical Tourism Corporation facilitates affordable medical and dental treatment at world-class international hospitals and clinics. Fill out the estimate request form on our site, medicaltourismco.com, for a free quote.